Hey everybody, Roger Levin here with a Dental Business Insight from Levin Group during the COVID-19 crisis. We've been working very hard at Levin Group on developing recovery strategies, and so far we've literally identified 37 strategies that we'll be putting in place in practices. One of the areas that was a discussion, because strategy starts with discussion, was what's going to happen to dental hygiene when we move back into our practices. Now, the first place you begin is by looking at the 2008-2009 recession, and in that recession, we have certain evidence. It won't be exactly the same as to what happened. But remember, in that recession, there was no concern about health and safety. So what happened in the 2008-2009 recession is dental hygiene became extremely light. Many hygienists were laid off, entire classes of dental hygiene students were graduating, and literally nobody was finding a job. And that went on for about 2 or 3 years, because that recession lasted a full 5+ years. The recession was 2 years, but the economic downturn was 5+ years and lingering, and then gradually hygienists were hired back. We do expect to see some of this again, unfortunately. Now, the first couple months when you get back into practice, on the Levin Group timeline, we call months 1 and 2, the first phase, there'll be a lot of pent-up demand. Months 3 through 5 is where you're going to start to soften, and production will drop anywhere from 15 to 50% in practices. The better your systems, the better you're prepared, the lower that drop will be. But here's the main point. We don't know what regulation is coming. So will we have to have more time between patients and all? We don't know. Everybody's asking, and some people are making statements, but nobody actually knows right now. So what we look at from 2008 and 9 recession is hygiene will be lighter because patients will not be coming in at the same rate. That's an economic factor from that recession. People just didn't want to spend money. They started canceling appointments. Some people stopped going to hygiene altogether. But here's the good news. We have evidence that hygiene patients are rescheduling when practices are contacting them. There are practices out there already rescheduling their patients, and some patients aren't calling back, but a lot are. So we do think hygiene will be a viable revenue source. We just don't know the extent to which patient mentality will be affected by this recession. So you'll find out, and you need to do everything you can to reschedule every patient possible. As always, we wish you dental business success, and I wish you safety and health.